everyone. Happy Friday. Thanks for being with us for this April Lift the Rock. So glad you can join us today. As always, my name is Ashley Jones. I'm the Managing Director of Community Programs here at the Venture Center. And today's Lift the Rock is going to feature Eddie Mraz, who is the Specialty Services Manager for the ASBTDC, also known as the Arkansas Small Business and Technology Development Center. We also have Dr. Lillian West, who is the CEO of Bear Fruit Direct Primary Care. And if you've participated in a Lift the Rock before, you sort of know the run through, but if not, welcome. And we feature an economic development resource or an entrepreneur support organization. So Eddie will talk a little bit about the ASBTDC and how they help entrepreneurs. And then Dr. Lillian West is an entrepreneur and a doctor. And so she's going to talk about her entrepreneurial journey, how the ASBTDC has helped her and how she's navigated through starting a business in this time of COVID and where her business is headed. So looking forward to this conversation. But before we get to that, big thank you to our sponsors. Our sponsors are extremely supportive. They support all of our community programs that we have throughout the year. So I wanted to give them a shout out. Frost Accounting Firm, Simmons Bank, Wright Lindsay Jennings, the Little Rock Regional Chamber, Entergy, and Central Arkansas Water. So thank you to all of those sponsors. And also some of the programs that we have coming up. Just wanted to remind everyone, we have a workshop coming up on how to future-proof your business. So this is going to be with a panel of Simmons Bank professionals. And so they're going to talk through how to future-proof your business. That's on April 27th from noon to 1. And also on April 30th, we're continuing our VCLiftThe mental health series. This is what we kicked off and started back in January, focusing this one specifically on mental health, entrepreneurship, and children, how to juggle all those components. That'll be on April 30th from noon to 1. So if you'd like to register for either of those events or other events that are coming up, you can do so via our website, venturecenter.co. You can follow us on social media. We're on all the different platforms, or you can sign up for our newsletter. You can also do that via our website as well. So now that all that's out of the way, I want to give Eddie and Dr. Lillian West a chance to introduce themselves, and then we'll get into the Q&A portion. So Eddie, go ahead and introduce yourself.
Thanks, Ashley. And first and foremost, I just want to say thank you so much to Ashley and the Venture Center team. You know, one of their things is collaboration, and they actively seek it. And so I just appreciate the time to even be on here and working with you all. So I'm Eddie Mraz. Bear with me a little bit. I went hiking a few days ago and pollen season is in full swing. And so I got some sinus stuff going on, but I didn't want to miss this. So I'm kind of pushing through it. I work for the Arkansas Small Business and Technology Development Center. It's a really, really long name. We help develop small businesses. That's essentially what we do. What I love to say is we are a business consulting organization, and we operate as a nonprofit, so our services are at no cost. So we help consult entrepreneurs from starting their business all the way to scaling and growing their business. And what I'm super excited about today is we get to really interview and just chat with Dr. Lillian West, who's one of our clients who came to us to get started, and now she's fully in business, and we're continuing to serve her. So that's a little bit about the ASBTDC and hopefully a little bit about what you're in store for today.
Dr. West?
Oh, yes. So, hey, everyone. Again, thanks for the opportunity, Venture Center and also Arkansas Small Business Development and Technology Center. I really appreciate this. So I'm an internal medicine physician, and I've practiced for the last 10 years. And as an internal medicine physician, I'm equipped to handle a broad spectrum of illnesses and chronic disease, as well as health and disease prevention. And so, yes, I'm originally here from Little Rock and born and raised, went away for med school and residency at OU Health Science Center, and decided to come back and plant roots back home. A little bit about me.
Fantastic. So now I'm going to turn it over to Eddie, who's going to ask and moderate some questions for Dr. West, and it's all about navigating this entrepreneurial journey. So Eddie, go ahead and take it.
All right. So everybody, you're in for a great treat. Buckle in. We're about to hear from from just an awesome entrepreneur who's had to navigate a lot and who took advantage of a lot of resources along the way. And so hopefully we can kind of pinpoint that. So Lillian, you and I got to catch up, before this, and I just got to hear the incredible story. And I'm a big Simon Sinek fan, for anybody who doesn't know that. So I'm going to ask, why start this business, right? Like, why did you even get into this space? I mean, you're a doctor, right? Making probably pretty good money doing it, in a practice for somebody else. Why go out on your own? So walk us through why you started. And then I think, if I'm correct, you started in late 2018. So kind of walk us through just that journey, that first year of trying to get it off the ground and get started.
Yes. So I've always wanted to have a primary care clinic. That dream was back in college, I'll say, growing up, seeing how physicians just healed patients. I thought that was my life's dream. And anyway, working through the hospital systems straight out of residency, I enjoyed doing that, loved taking care of patients. But I found that it was becoming increasingly difficult to spend the time with patients as I generally like to do. And it was time for a change. And that's how I had heard about the model direct primary care. Actually, a friend in Houston had posted an article about it online. And so as I had read that article, and then a couple of physicians here locally started a practice similarly, and that gave me the confidence to say, okay, that pendulum is swinging now. It's time to jump aboard and do this thing that I love, on my terms.
Walk us through a little, because not everybody understands what direct primary care is. So a little bit about that business model. Can you just kind of explain a little bit further?
Sure. So direct primary care is an alternative payment model in which our patients directly contract with their office or small businesses to obtain healthcare services. And that allows us to alleviate a lot of middleman, actually, because it allows for us to spend quality time with each patient, develop individualized care plans, also discounted labs for patients that are uninsured or underinsured, medications, as well as imaging sources at cash prices. So it really is a cost-effective strategy, and a portion of patients who may not have known that those services were available to them. So so that's what our services offer: unlimited visits as well.
Yeah, it's really interesting to watch this model kind of really emerge. The Venture Center works with a lot of companies around disruptive technologies, and I kind of see this as somewhat of a innovative and disruptive business model. When so many solopreneurs, small business owners, they just can't afford really expensive healthcare plans, right? And some of them, not all of them, but some of them, don't need super intensive healthcare services. And so this model kind of helps fit that need. So it's incredible to kind of watch you kind of work through this really innovative approach to how we service healthcare. So Lillian, it's 2018, right? I think it's late 2018 based upon our discussion. You're going into 2019 and you're trying to get this thing started, right? You're kind of like, hey, I'm gonna go do this. Walk us through what those steps were. What was that early to late 2019 look like for you trying to prepare to get the business open?
Absolutely. So during the planning phase, I met with a financial advisor. Actually, it was in my community group from church, and he brought over a banker, actually from Simmons, and he mentioned going to the Arkansas Small Business Technology and Development Center, and we called. And so when we called, we set up the appointment and met with Patricia there. And that's how we got our business plan together, which is obviously very important to approach to banks. And then also just looking at the numbers, what's important, what we could afford with equipment and all those things that, being a new, entrepreneur, it's important to put pen to paper. So that was that was that was good. And then later to find out that my mom actually went through the ASTDBC as well. So I thought that was just pretty awesome. Yeah.
No, that's good. One thing two things I really want to point out on those comments, shameful plug, but I just want to expand on it a little bit. But, a full-fledged business plan isn't always needed to get started, right? Depending on what you're trying to do, you probably don't need a 10-page, 3-year financial projection plan. But what's super key and what I want to hit on is if you're going to approach a bank for a business loan, you do need that. And so we work very, very closely with our banking partners to prepare our clients to successfully get a loan. And so that's, I would say, one of our core competencies as a consulting organization is helping entrepreneurs get access to capital. I think last year we helped our clients get access to almost 90 million, which is a lot because of COVID. On a typical year, we do about 50 million. But what our consultants are very, very skilled at is the proper way to approach a bank for a business loan. And that's kind of how Lillian kind of got into our network. Was she did need access to capital. And there's a lot that goes into that, preparing for it. One other thing that Lillian brought up while we were talking about her story is the market research that kind of came out of that planning process is looking at the market and seeing, hey, is this even feasible, right? How much will I actually be able to make in the given year? And will that cash flow for my project? That's something that we specialize in as well. And I wanted to get an example together if I was going to do a presentation, but we're not doing a presentation. But Mimi and your team at the Venture Center, I think last week, the week prior, you guys did an example of the Bushy Tail Coffee Shop, which I just think is super cool, especially since there's a coffee location below you that's probably open. But to give you guys an example of some market research, if let's say the Venture Center wanted to open up the Bushy Tail Coffee Shop, they could approach us and we could essentially see how much people were spending for coffee in that given area for a certain amount of time. We could also look to see what the population during the day would be for that coffee shop, right? Because you're in a downtown retail location. So from a consumer spending standpoint, we love to use that data to enrich those business decisions. So when Dr. West came to us, we said, well, let's see what the market will actually look like for your services so that we can help you make educated business decisions. So wanted to highlight those two key points in terms of the business planning, because those get super important, especially when you're accessing capital. Okay, Lillian, so you got open in November 2019.
Mhm.
Does everybody hear that? November 2019. What happens not 6 months later, right, is insane. I think the story is going to be really cool. But walk us through November 19 to right before COVID started, right? You're just now getting open. Are there any key lessons that you learned? We have entrepreneurs on the call right now that are just like, man, I'm getting ready to start in 4 or 5 months. I wonder what those first few months are going to be like. Any wisdom you want to share with them? Anything that you learned in those first 4 or 5 months before COVID, right? We're going to get into that crazy story, but anything you want to part with everybody listening?
Yes, I'll say it's going to feel pretty amazing because it's like pinching yourself that you've actually started this vision that you saw comes to life. And so that felt good, honestly. It is a steep learning curve, obviously, because even though you may be very skilled at the gift of what you do, your profession, it's still the business side you may not know. And so learning that part, I think, is important to realize that you may make mistakes, obviously, but you just have to keep putting one foot in front of the other. And it may not ramp up as quickly as you'd like, but as long as you continue dedicating, what it is and remembering the why as to what you are doing, then you can stick with it.
That's good stuff. I think Something that you pointed out that I like to hit on is most entrepreneurs are really good at the thing that they're doing. And they didn't go into business to be this business person. They came in to service a need that they were really skilled at. And I just saw Patricia kind of chime in on the chat. So I want to give her a shout out, because what I want to encourage everybody is exactly what Dr. West did. And we're going to talk more about it, is she stayed connected to a business consultant. It wasn't just help me get this business loan and then now I'm going to go figure it all out. One thing I love to tell entrepreneurs is it's lonely. It can be lonely. It doesn't have to be. You have tons of resources. You have mentors at the Venture Center. You have consultants like Patricia Long, who was Dr. West's consultant. You have a lot of people who want to walk alongside you, even after you open your doors, because there's going to be a lot of challenges. And so keep those advisors really close to you. Okay. Lillian, this is where the story, clearly for anybody in the world, gets crazy, but it's just so incredible to watch you be resilient as an entrepreneur and walk through this. So you opened in 2019, you're blowing and going, super excited. And then April of 2020 hits and the world goes nuts. And you're in the healthcare space, so it's even crazier. Walk us through that next 6 to 8 months of just being a business owner, trying to keep the doors open in COVID as a doctor. What was that like?
And so with the clinic being very new, and the unknowns of the virus, we didn't really know what to expect. Still very happy that we started it, because even though through the uncertainty of what was going on, our business model, we were offering telemedicine or telehealth as part of our business model. So I feel like our patients didn't suffer from a continuity of care. we did close. That's how we kind of pivoted. We started doing more of the telemedicine, obviously, for our patients, and then offered it to to Arkansans, because of there were a lot of offices, unfortunately, weren't quite prepared. No one really was prepared for this to happen. But we were able to offer the video visits and that kind of thing during that time. And so that was really good and helpful. So I'd say it was like divine intervention, because we were able to continue doing that for our patients until we were able to return to in-office visits.
It's always good that your business model had something innovative in it in the beginning. And so when it was time to really readjust or move in terms of the market, you were already doing it. And so you just kind of had to accelerate that. That's fantastic. So Dr. West, it is a tough year for small businesses. And I'm sure the Venture Center feels this way. And I certainly feel this way of joining the team at the ASBTDC. But 2020 was the year of small businesses, right? It was the year that the whole world said, we need to support small businesses. And it's incredible to be a part of a team who does that. Walk me through, what resources did you kind of pull on as you were going through the pandemic? Did you, I know Patricia stayed pretty close to you, but was there other things that you were kind of, utilizing to really just navigate the changing markets?
Absolutely. That's where like the medical organizations came into play. It was just pretty phenomenal how the medical community pulled together. So physicians would stay aware of, the current crisis. And so obviously through the pandemic, there were costs of doing business that was not accounted for. The expenses of PPE and a lot of physician offices and even hospital systems didn't know where we'd get it from, and the expense of obtaining it. Those were all stressors, in the beginning of a new clinic and the middle of a pandemic. And so what was awesome is that, again, a lot of the medical organizations pulled through, and there were grants available for small businesses in Arkansas. And then medical organizations also provided PPE And so that was very helpful until we were able to get some from our vendors. And so that was really good. And so that made things, that's how we were able to reestablish and get patients seen again that needed to be seen, in the office, and provide the telehealth to those who had COVID, and able to continue taking care of them while they were ill. So.
Okay. Yeah, I couldn't imagine. I mean, I really couldn't imagine being a physician's office and trying to deal with the tough supply chain of PPP. Just that's insane. Or PPP, I mean PPE, sorry. That would be a super big challenge, especially being a new business owner. So I'm glad that the community, the medical professional community kind of came together. And I guess I would take a moment to echo that, and anybody who is in an industry right now or getting into starting a business, look at your industry associations as well as resources. They are also helping provide a lot of tools and resources as you are getting started as an entrepreneur, just as Dr. West just explained of how they really helped during COVID. So Lillian, you're 6 or 7, 8 months into the pandemic. You're coming up on a year being in business. Whew. Think about that, a year being in business and everything that's occurred. I think you started taking advantage of some of the new services that we launched. Could you share a little bit about, at that 1 year mark, what you started kind of focusing on?
Yes. And so, with pivoting, there were a few other changes that obviously that happened in our clinic and personally, death of a relative due to the coronavirus, and becoming the solo physician at the clinic. I called Patricia because we were having to make some shifts with employment here. So she was very helpful, and I didn't know that I always get the words.
Okay, it's super hard to say.
Technology and Development Center had an HR professional, which I learned through the BNI group also that I was part of. And she's just been amazing in helping with structuring that portion, and as well as marketing with Yana. So both Linda and Yana through the ASTDC have been great in helping through the process, as well as contracts and so forth. So just going through some things, it's been really good.
Yeah. So I want to hit on that because it's something really, really brand new that if we had a slide deck, we probably really want to hone in and talk about it. And Lillian, thanks for sharing a little bit of it. But, ASBTDC, one of our core values is to stay relevant in front of our clients, right? As the markets change and the needs change, as an organization, we have to as well. And so back in August or September, we really kind of looked at our portfolio of services and decided we wanted to invest in some additional lines of service for our clients. And what Dr. West took advantage of kind of at that 1 year mark of business was what we call our subject matter experts. And so we have a portfolio of specialists who specialize in certain areas of the business that we then pair up with our clients based upon their need. And so she got engaged with one of our HR specialists who came in and consulted Dr. West strictly around HR. And then after we did that, she was like, and my next question is, she is like, I need to get on the offensive side and I need to start growing my business. I need some help with marketing. And so we plugged her in with a specialist who was strictly focused on marketing. And if I'm correct, Lillian, you're still working with Iana, who's that subject matter expert specialist that's working with you on really trying to grow your business from a business development and marketing standpoint. Is that correct?
That is correct.
So walk us through now. You're past a year mark where you're now into 2021. And from what I can tell, you're doing a lot of activity on the offensive side of your business. How is that, being the business owner, being the primary physician, and wearing a lot of hats, but business development is certainly one. And I was listening to, I think, a webinar a few days ago where They said a lot of businesses fail. Well, Wayne talks about this all the time. If you don't have customers, you don't have a business, right? And so you kind of understood that and said you had to get out and start doing that. Walk us through kind of what you got going on right now in terms of business development and growth.
Yes, obviously the goal is for continued growth of our clinic. And so what I've been doing is doing more networking. I am naturally more of an introvert. And so being a business owner, I learned quickly that you have to kind of get out of that because, or at least take more chances with just getting out there and noticing what's out there and who can help you and what you do and how you can help them, you know. And so that's kind of what I've been focusing on. Been speaking to some organizations as well as getting in front of some small and medium-sized businesses because those same benefits that we offer for individual patients, self-employed or independent contractors, or those who are uninsured or insured or uninsured, any of those patients, those small businesses can get those same cost savings, the cost-effective strategies. So letting them know we're here, letting them know that we could help them in ways that they may not even be aware of just yet. It's just educating the public.
Yeah, I think I've seen that you mentioned you're in BNI, right? So if anybody doesn't know about that's a network referral group that Lillian's in. I think there's some other folks here on the webinar that's in that. I think you started presenting to the Central Arkansas Human Resource Association. So you're starting to look at associations to get involved with. You're developing some referral partners. And so you're strategically going after certain target audiences to grow your business. I would bet that some of those are on this call. So Dr. West, walk us through just a little bit on if I'm a solo entrepreneur, meaning it's just me, I just have my own business, or I'm a small business owner. I got a small team, maybe 2 or 3 folks on my team. Maybe it's Bushy Tail Coffee Shop, right? I can't afford to offer benefits, but my staff is awesome. What does that look like for us to become a client of your service?
Yes, so all you do is you'd call us. We could come and talk to your staff. But what we find is that small businesses can save up to 40% in some cases of healthcare cost, for their employees and themselves, because not only do we have relationships with lab companies, but also with cash price imaging and now the ability to dispense medications to help lower cost. And so those things are going to help their bottom line, their small businesses. So that's important. And then another thing is that a lot of entrepreneurs or those who hope to become entrepreneurs are afraid to take that leap because they're afraid of losing their health insurance, or their benefit that keeps them there. They have a dream, but it keeps them there because they're afraid. Well, our clinic, 85 to 95% of things can be handled in a primary care clinic. So able to help those patients, and then there are all kind of wraparounds that can help with DPC with, that still will lead to decreased costs. It's important for patients to have some type of catastrophic coverage, so we can help them, point them into directions to have that as well. And so for small businesses, medium-sized businesses, they can call and consult with us, and we can see maybe what they have and compare and talk about some things that we might be able to do to help their bottom line.
Thanks for that. So I just have, like 3 more questions or so. Ashley, we still good on time? I think we are.
Yep, all good.
So one of my last questions, Lillian, we just walked through, you wanted to start a business, didn't really know exactly how that would be, but you knew you needed access to capital. You needed to kind of figure that out. And then COVID hit and you're trying to keep it all together, keep your doors open. And now you're kind of coming out of COVID. as a business owner, and you're getting on the offensive side, you're trying to grow your business. So to me, there's just like tons of just incredible pieces of wisdom that life as an entrepreneur that you've lived over the last, 2 years, right?
Mhm.
If you could sum up one or two, I'd ask three if I can get three out of you, but just key things that you would want other entrepreneurs to know about as they're getting started.
Um, One, I'd say if you have um, a dream or a vision to start a business, to write it down and see where you want to be or what you want it to do, or what you want to do. Two, just start putting one foot in front of the other. Contact a business consultant like the Arkansas Small Business Technology Development Center, so that way you can put pen to paper for a plan, right? So you see it and then you like continue doing the plan. And three, know that this road will always bring some type of curveball, but you have to always remember your why and why you want to do it. The pandemic was a curveball for many, and just being an entrepreneur and in business, there will be curveballs, but you have to remember why you're doing it, and if you love it, you will continue. You'll feel like you can't go back.
Yeah, no, that's awesome. Those are good things. Thanks for sharing that. So my next question, and almost my last, it's my second one. I'm kind of a book nerd. I actually don't read that much. I wish I read a lot more, but I enjoy reading some books. So, Dr. West, what are you reading right now? And then also, what's a book that you would recommend maybe to our listeners who are an existing business owner right now? What would you recommend?
Okay. Well, there is a one book that I'm reading for personal enjoyment called "Winning the War in Your Mind."
Love that book by Craig Rochelle.
Yes, by Craig
Oh
Roach.
my goodness. I'm about to read it a second time and do a Bible study on it. It's so good.
Because our lives move in the direction of our strongest thoughts. All right. So that is a book that I'm reading currently. And that's actually before starting the business, he did like a podcast. Don't get off subject, but I wrote that down and it's on my wall. So those are things that keep you motivated through what you're doing, and what you want to achieve. And so that is one book. Another book that I read during this process is called it's called Call to Create by Jordan Rayner. And so that was also a good one. But I've gotten other books like Profit First. Those are important books for entrepreneurs too, just to kind of look at that. But yeah, you'll
It's good
enjoy
stuff.
learning once you start.
Yeah. I think, I was on a call with somebody yesterday, and you can hear it from Lillian today. Both of these are business owners I'm referring to. And what I picked up on is that they were lifelong learners. Being in business, if you're just kind of staying in the same game, it could go backwards. And so just continuing to stay up on good things and to learn is really important. And so awesome. You mentioned Winning the War in Your Mind. Like, I've been all about that book. It's such a good one. Thanks for putting it in the chat. Okay, so last question, and then hopefully we get some Q&A kind of rolling. Is how if we want your service, Dr. West, where do we find it? How do we get in touch with you? What's the best way to go about that?
Yes, so you can call our office at 501-301-4607. We are located off of Highway 10 at 8221 Ranch Boulevard, Suite 2 in Little Rock. And our website is www.bearfruitdpc.com. And there's a way to enroll or put in your contact information if you'd like us to contact you. So yeah, those are ways to reach me here.
Awesome. Thanks so much, Dr. West. It's been so much fun just kind of walking through your story. Hopefully, what I'm hoping that came out of this is we inspired some entrepreneurs to take the next step and to know how to do that, and to motivate some people to keep on pushing forward as they're running your business. Ashley, it's all back to you.
All right, I'll take it. Thanks so much, Dr. West. That was, a fantastic story, and I know it's inspiring to several entrepreneurs. Do want to open it up for questions. If anyone has a question for Dr. West about her business, or has a question for Eddie about the ASBTDC and how they can help their business, feel free to pose those in the chat or the Q&A feature. Raise your hand, I'll unmute you. This is a safe space. Feel free to ask whatever question you've got. We do have one question that's come through. For Dr. West, how do you, or where do you get your motivation?
I'd say that my motivation comes from trying to see the end. And so, that helps to see where I want to be. Again, I find that writing it down of what, I envision helps to try to achieve that. So keeping that up front is helpful.
That's fantastic. I want to leave it up for any other questions. While we're waiting for some to come through, Eddie, like you did for Dr. West, if someone wants to reach out to the ASBTDC for their own business idea or growing their business, give some information on how to contact your group.
Yeah, thanks for that, Ashley. I would direct you to our website, and I could put it in the chat here in a second, but it's www.asbtdc.org. And you can register for services there. We service a little over 5,000 clients a year, and it's growing. So we'd love to talk with you and see how we can support you.
Perfect. And we did link that website in our chat, and we also linked Bear Fruit as well, if you'd like to follow up with Dr. West and are interested in her services. Another question that has come through, Dr. West, what did you do on the days that you wanted to quit, when you just wanted to throw in the towel? Did you have those days, and what did you do?
Yes, I think that those days when the curveballs hit, you wonder, what am I doing? And so, yes, I think everyone, will have those days, but you have to, again, I think, remember your why, and remember why you're doing it. I love practicing medicine, so I know that I feel this is what I'm purposed to do. And so, the business part may be difficult in some instances, or just difficulties in general, whatever it may be. You have to keep going and remember why you're doing it, and the beauty of taking care of your patients. In my field, the beauty of taking care of those patients and them enjoying it, and then seeing the fruit of that. Seeing a situation where their lives changed, and they told you how that was done. So, and then the support, the support that you have from either you get that from family, friends, community groups, or you lean in on that, because it's good to have that support to keep going as well. And your business consultant, and you can lean on to who you have for support. You keep friends, all of that.
Absolutely. Support and a network is crucial in moments that you want to throw in the towel and quit. Words of encouragement. Another question has come through. They want to know a little bit more about how you've been marketing your business. Can you speak to that?
Yes. So marketing for the direct primary care clinic has, it's really word of mouth for our practice style. Our patients tell their family, their friends, and we've been doing some social media as well. Again, patients are your biggest help. They're the ones who will tell others about your practice. And so with the direct primary care model, a lot of that marketing has been word of mouth, but also being more engaged with networking, like BNI, again, getting out of the comfort zone, and then marketing through speaking engagements, opportunities that will come. That's a way to market what you do and showcase what you do.
There's another question about funding. Did you have to raise money to get started?
And so there was not raising money, but we did go to a bank to get started with the clinic. And most businesses will, new businesses will require some funding. It'll be great if you're able to self-fund, for sure. But, if you have something that you desire to do and you need the funding, then obviously you have to do what you have to.
Absolutely. That is the dream. Everybody wants to be able to self-fund their business and not rely on outside sources. But if you do need them, they're available. You mentioned going to a bank and having your business plan prepared, and having that relationship there is really key, and helps you grow your business. There was a funny question, Eddie, I have to ask it. Wayne says, how long have you been growing your beard?
Wayne, it's good to hear from you. I've been growing out a handlebar mustache. I don't know if you guys can see, since January is kind of when I embarked on this journey. I don't know how much longer I'm going to do it. I do have to give a shout out, since we're talking about marketing, to the Handle Barbershop down the road from the Venture Center. I've never ever paid anybody to groom my beard, but I recently have, and they are phenomenal. So just give a shout out to them.
Perfect. Support entrepreneurs supporting entrepreneurs. That's how it works
It's
around here.
It's a way to do it.
I don't see any other questions, but we do have some minutes. If you'd like to spend any last minutes, comments, things you'd like to impart on our audience before we wrap up. Eddie, you can go ahead.
Okay. I actually want to, and you might already talk about this, Ashley. So hopefully I don't either steal your thunder or overextend. But I want you to talk about your mentor program that you guys have, because something that I mentioned during this conversation with Lillian was, she had a business advisor, Patricia Long, who's literally walked alongside her through this journey. And we'd love to be that for whoever is looking for that. But, I made the comment that entrepreneurship is lonely. It can be lonely. I love that what you guys are doing in the mental health space. The book that Lillian talked about that's what that is what's going on up here, and can you get in control of it? But it doesn't have to be lonely. Like, it's incredible to see how many resources are available right now. And so I don't know if you're already going to talk about it, but I'd love for you to just share a little bit more around your mentor program, so that people just really know you do not have to go on this journey alone. People are willing to step up.
Absolutely. And thanks for mentioning that. We do have a mentorship program. So outside of all of the, Zoom functions and programs that we offer, all of this is built on the foundation of mentorship. All entrepreneurs need mentors, and there are several mentors that have built, raised, sold companies, been a part of it, that are willing to help and help you navigate, the tough times and see, potential risks that you might not always see. So we do have a mentorship program. It's focused on people that have businesses. There are several resources out there like the ASBTDC that help people with ideas and that sort of thing. We're always happy to rope in those folks as well. But we actually match our mentees with mentors based on their industry and what they're looking to get out of the program. And so if anyone is interested in that, I'd like to give a shout out to Annalise Armstrong, who's on our team, who's running our mentorship program. If she could drop her email in the chat, she is willing to chat with you and see if this program is right. And if it's not, we can find the resources that are right. But it's a fantastic resource for entrepreneurs that are looking for help in navigating this space, because it can be confusing and lonely and overwhelming. So that's extremely important. So thanks for that plug, Eddie. Dr. West, any final comments you'd like to make?
I'd just like to say that if you are
looking to start a business, or you have a dream to do it, yeah, just write the vision and make it plain and go for it, because you know, don't let fear stop you from doing something that could potentially change someone else's life, not only yours, but someone else's life for the good.
Absolutely. Hey, Ashley, I got one thing on the top of what Dr. West said. Also, don't let the scare of healthcare coverage stop you from starting. So I just want to, kind of drive home what we've talked about is the model that Dr. West has is really prime for somebody who is independent contractor, solopreneur, small business owner. I would encourage you to really go to her website and check out those services, because they're not always a good fit for everybody, but that doesn't have to be a barrier in terms of you pursuing your next step. So I'd encourage you to go check that out, because I do think I love the model. I really, really do. That's why I was so excited to have Dr. West on here today. Is this model is so innovative on a new way to approach healthcare for people who need something like this. And so entrepreneurs, small business owners, independent contractors are on this call. If healthcare coverage is a challenge for you and your employees, this is a viable potential solution, and I'd encourage you to take a good look at it for sure.
Thank you, Eddie.
Awesome. Well, thank you both so much, Dr. West and Eddie Mraz. Thank you for sharing your story and sharing how Eddie, how you've helped entrepreneurs, and it's been just a great story to hear. Thank you to all of our participants that asked questions. And also thank you to our sponsors. Lots of thank yous going around. Our sponsors: Frost Accounting Firm, Simmons Bank, Wright Lindsay Jennings, the Little Rock Regional Chamber, Entergy, and Central Arkansas Water. Huge shout out to them. If you are interested in mentorship, as Eddie mentioned, feel free to reach out to Annalise. Check out the ASBTDC. Check out the services that Dr. West provides at Bear Fruit Direct Primary Care. We hope to see you again at one of our future programs. Until then, thank you and have a great rest of your Friday.